Hello, my name is Dr. Scott Young, and today we are going to talk about what to expect from an audiological evaluation. Coming right up. Okay, when you think about an audiological evaluation, most people go, a what? Okay, it's another way of saying it is hearing evaluation. Why do we get scared of this? It is scary for some people. They look at it as, do I have to show that I'm less than who I am? That's what it feels like. I mean, we think about that with all kinds of other evaluations that we go through in our life, especially as we get older. Well, then I have to wear hearing aids and they're going to make me look old, right? And I'm admitting to something. Guess what? You're not really admitting to anything. Everyone already knows it. And you're talking to someone who wears hearing aids. I wear hearing aids. I know what it feels like. I know what goes on. I remember the first time I thought about whether or not I should wear hearing aids. Let me tell you a little bit about the history of audiological evaluations. Now, it wasn't called audiological because it was in the 40s where hearing aid dispensers were, and other people, psychometrics, were actually looking at hearing testing. Now, if you've watched my other video on the USS Missouri, you will see this conversation. All of the World War II veterans came back with massive hearing loss, and no one knew what to do. And so we had to update all of our processes. You see, we had these weird things called Bekasi audiometry, or Bekasi is another way of saying it, that you'd push down the button when you heard it and you'd let go when you didn't hear it, and push it down when you heard it and let go. And it would look like this really weird wave, and we would learn the waves. Then we've changed it up over the years and we've updated it. Now, some people haven't kept up with some of the updates, but there are unique ways that we have to look at your hearing. Now, there are hearing aid dispensers versus audiologists. Now, what does a hearing aid dispenser do that an audiologist doesn't do? Now, if you talk to hearing aid dispensers, they say, well, we do nothing different. That's not true. In the state of Oklahoma, just like every state, they are not allowed to diagnose hearing loss. They're trying to find out if you can wear hearing aids or not. Now, it seems like a bit of doublespeak. It's not trying to be mean to them. They are just doing, that's part of their job. They're licensed at least to do that. Whereas an audiologist is really going to find out the depth of hearing loss. And so we're looking at wax removal issues. We're writing reports to ear, nose, and throat physicians, to general physicians, and all that kind of stuff that we're looking at. We're also looking at whether a person has depression and should we refer them on to another evaluation of some type. So there's a lot of things that are going on involved with that. We audiologists will also see children to adults to all kinds of different diagnostics that can happen. Now, you're first ruling out medical problems. Most people think you look into an ear and how much are you seeing? So you're going to see this little slide up there. And when you look at an ear, you're only seeing the first, the first third of the ear. You're seeing up the ear canal to the eardrum. And if it looks red, you might think there's something wrong. I'm going to tell you a story I was mentioning to my son. He was asking about how ear infections can pop an eardrum. And I was talking a little bit about this, and I think it was maybe 20 years ago, I saw these two girls that were 21 years old, and they were twin sisters. They had had multiple ear infections. Their eardrum was pocked full of scar tissue all over the place. Do you know how much hearing loss they had? Next to nothing. They were borderline normal, even with that pocked full eardrum of all that problem. You see, it's not just the eardrum that causes the problem. And yet popular literature talks about, oh, you popped your eardrum and you have that problem. There's more to the story. There are the ossicles, the bones, the smallest bones in the body that could sit upon a dime. And that smallest bones of the body are pumping in a piston-type motion. to send in sound. Now, when we have a problem in there, that's an ear infection or some type of breakage. Do you know that boxers have been beating each other up quite a bit, and they will have concussions, but they will also have broken ossicles. Those broken bones will cause a problem because it's called disarticulation. They're not articulated together. And ear physicians will go in and have a boxer who's maybe in his 40s, and now he finally gets the surgery to fix himself up because he's going to keep breaking those bones. And that can bring that hearing right back to normal. We do have people who have massive eardrum problems as well. Then we go into the inner ear. The inner ear is when we talk about hearing loss that can be addressed by hearing aids. That's what I have. I've had a lot of music issues where I'm a musician. I've been around a lot of loud sounds, and I've had dozens of surgeries on different parts of my body. And when you have that, you can have a slowdown of the processes of your sensory issues. And so I have several little sensory issues that are going on around me. Now, one of the things that you look at, there are three basic areas. It's called air bone, then we have speech, and then there is speech and noise capabilities. Now, air and bone is when you push the button, you'll get in there, they'll put the headphones on, and we use insert plugs. Why inserts versus headphones? Well, guess what? When headphones can distort the ear, they can give you a bit of a distortion of what we're actually doing. An insert actually goes deeply into your ear canal, and we get a better test. And so all of our testing is done by that means. And what you're doing is pushing the button to hear the beeps, and you're getting down as low as you can barely hear it. And we're doing that as an idea to know how well or how poorly that you hear. The second thing that's terribly important that most of the hearing aid dispensers don't spend a lot of time on is speech abilities. We have this thing called a speech reception threshold. That's the lowest point that you can hear that sound. And then we move on to most comfortable levels, uncomfortable levels for the pure tones, all kinds of different things that happen in there. And we want to know how well that it happens. Now, I personally am one of those, it's called PB Max. I want to know your maximum ability to understand speech. Now, I know you're not always going to understand speech in the same way that I would test it in, but that's what I need to know is what your capabilities can happen. See, people who have a poor ability to understand speech could have had all kinds of viral infections. See, viral neuronitis is one thing that can kill off one ear, and it happens just like that. We have other patients who've had strokes or other kinds of illnesses that come up and affect speech understanding. Now, you don't want to just stop at speech in quiet places. I know you're saying, well, what are you talking about? Okay, we're going to get onto that a little bit more. Speech in noisy circumstances help tell patients how well they hear in noisy places. Now, very few people are doing speech in noisy places. I mean, I've looked at the research, and about less than 30% are really looking at that. Well, that's something at Hearing Solution Centers we always want to look at. And when patients come out, we finish the testing, we pop the little things out of their ears, and they give me the button back. They say, wow, I've never been tested like that before. And it's mostly because that's speech and noise capability. Now, the quantification that happens, that when we pull this thing together, the evaluation can take maybe 15 minutes, but we spend an hour and a half, and you say, what are you doing for the rest of it? We're trying to look at what you're experiencing versus what you're feeling about it. We're talking through those areas. We're talking through the problems that happen. Can I just tell you a little quick story? I had this person that came into my office, and I had a guy named Rickles, and I've mentioned him before if you listen to this. And Rickles comes back, and he's always hair on fire every time. You got to see this guy. Okay. So I go in the room. This is before he had speech testing available, a long time ago. And he says he doesn't understand what this hearing is. Now, these are old analog type of hearing aids, and I'm looking through the paper file. I don't see anything wrong. I'm talking to him. I'm like, he goes, well, I don't understand. And I'm like, Who don't you understand? Really powerful question. Well, my wife. Okay, look over her. Why do you think he has troubles understanding you? And she says, looks back at me, she says, I don't know, he just doesn't understand what I'm saying. Huh? Ma'am, I got the answer. You're not presenting your voice very well. It's just the reality that we have to look at. We have to look at all of those communication issues. So we spend a lot of time explaining this stuff so that you can understand. And we have to go back over this stuff over the months and years to explain what's been happening for people, because they get into all kinds of crazy situations and they wonder about whether it's working. Now, did you know something interesting? I used to work for a hearing aid manufacturer, and less than 20% of all dispensers or audiologists ask the hearing aid manufacturer for a prescription. They let the hearing aid manufacturer, with the bare minimum information, pick the prescription. That is a quantifiable sin in my field, okay, in my circumstance. I will never let a patient let the manufacturer pick out a prescription for my patient. I am gonna be very picky about that. We have very quantifiable situations of how we're going to pick the prescription for that patient. Now, when we don't have the right information, we have problems with those manufacturers. I was at a convention and I didn't even realize this. It was one of the manufacturers called Oticon, and I will tell you the story that happened. It's not because Oticon's bad, it's just that people didn't know what they were talking about. And they were in this one iteration of their technology. They were, I asked this question, how do you pick the prescription based upon what you're telling me of this new technology? And do you know that my staff was asking the same question? One other staff member was my audiology technician, and the other one was another audiologist, and they were asking the same question. I didn't even know about it in the same kind of classes, asking this question, and no one knew how to answer me. It's because only 20% of us ever pick that stuff. I want to share with you, we spend a lot of time to make sure that we know everything. And when patients walk out of there, guess what happens? You're armed with understanding, with knowledge about what's really going wrong. You see, when I go into my optometrist and I have specific things that I'm looking for, I have distance problems at times. It's a very minor issue, but mostly when I'm on the computer and I can't read anything up front. I think it's funny because one of my hearing manufacturers, I kind of complained to them. I said, I cannot read your serial numbers anymore. And it's a friend of mine named Shanna. She's with Starkey. And Shanna Howard's hysterical. She goes, she's known me for 15 years, and she said, Scott, maybe it's your vision. Oh yeah, you're right. So it just was what it was there. Now, I also have to make sure that my glasses have a straight back a bit, that they can slip around my hearing aids. So I have specific things and they have to bend it in the right way. And you think about, well, of course you have to have that. But that's part of the prescription and part of the work that happens with optometry. But that same kind of thing times 18 million goes on in hearing aids. You see, in this, we're just bending light. Did you know that the hearing aids that I have 115 separate adjustments? And it's hooked up to my iPhone to make that difference. And I can play with the adjustments that there are about, 10 different adjustments that I can mess around with on the fly. And if we don't have the right prescription and the right information, we can't give you the right diagnostics that you can work from. So check us out. We're going to tell you a lot more about this. We just thank you so much for listening to us.